Hey, it's your girl, Enfermera Mami, aka Nurse Reb, and today I'm coming at you with the Nurse Converse podcast, Season 2, by Nurse.org. My name is Rebeca Leon, and I recently received my Master's of Science in Nursing Education and am recently received my Nursing Professional Development Board certification. I am also a proud member of the National Association of Hispanic Nurses. And today, in this episode, I want to come with a story of empowered voices, nurses advocating for change at the Hispanic Health Policy Summit. First and foremost, I want to give a huge shout out to the National Association of Hispanic Nurses and specifically the Policy and Advocacy Committee for planning and hosting the Hispanic Health Policy Summit. This episode is going to give you a brief overview of the conference, of the speakers, and of why our voices as nurses matters, especially as it relates to policy, advocacy, and change in the healthcare system and nationwide. But first, I want to give you a brief overview of the National Association of Hispanic Nurses, or NAHN, and what the Hispanic Health Policy Summit is and why it matters. The National Association of Hispanic Nurses is a nonprofit organization committed to ensuring high-quality healthcare delivery to Hispanic communities and fostering professional excellence among bilingual and bicultural nurses since its founding in 1975. So this is our 50th year. NAHN has established itself as the nation's leading professional society for Latino nurses, boasting over 40 chapters and more than 3,000 members. As the foremost Hispanic nursing organization in the United States, we represent the interests of 63.7 million Hispanics across the country. And together we advocate for the 2.2 million Hispanic healthcare workers, including 328,000 Hispanic nurses that constitute 9.2 of the nation's nursing workforce. Our organization is dedicated to championing healthcare policies that promote the health and well-being of the Hispanic community and beyond. So now that you know a little bit about our organization, the Hispanic Health Policy Summit is only in its third year, and we have been able to establish a legacy of advocacy as Hispanic Latinx nurses just in this time. Personally, I was so excited to attend the Hispanic Health Policy Summit, and I was only able to do so because during the National Association of Hispanic Nurses 49th annual conference, I was one of the raffle winners and had my registration paid for, which was just a blessing because of what it brought this experience for me. For me, as a Latina nurse and as an immigrant, this was such a special moment because I never imagined myself being able to go to the steps of Capitol Hill and advocate for my community, not just the Hispanic Latinx community, but for the nursing workforce as a whole. I had a moment of reflection where I was really just sitting there sipping my coffee, looking at the Capitol building in the distance, and I just couldn't believe that I had recently just been inside of those walls, advocating for nurses like myself and for people like us. For me, attending this summit made me realize that nursing is more than just patient care. It's about shaping the systems that determine patient outcomes. And for me, coming to the United States as an immigrant, becoming a nurse, and then now having stood in the halls of Congress fighting for change was honestly life-changing. Now, to get into the meat and potatoes of the conference, it was a 2-day conference that took place in Washington, D.C., just off of Capitol Hill. And we had some really incredible speakers come and talk to us. not just about Hispanic Latinx health issues and policy that affected that, but also about how we as nurses have the power to make change. And giving us some of those soft skills and some of those skills in general to be able to put them in our toolbox and use them to better our society. Not just in that moment, but also when we came home to advocate for our patients on the day to day. Our first speaker was Mildred Espinosa, the CEO and founder of EBLA Digital. She spoke on media and advocacy for nurses and how the media has a role in advocacy. She urged us to be a part of these nursing professional organizations, but also to partner with journaling organizations because we are the subject matter experts. We can't tell our stories better than anybody else. So we need to be able to partner with the media and tell people the impact that we have, but also the stories of the patients that we see on the day to day that impact us. She really wanted us to focus on how nurses can leverage media to amplify our voices, whether it's through podcasting like this opportunity with Nurse.org, or on our own social medias, or even reaching out to our local news outlets to get those stories out there. Of course, we want to make sure that we are following HIPAA regulations and all of these other things that are sensitive information drivers. But at the end of the day, if we're able to put faces to policies, we can make a difference and a change. For me, the key takeaway was that nurses are essential storytellers and we can help shape public narratives. But it takes every one of us to get out there and do it. I used to think that policy work was just for politicians or hospital administrators, not for regular nurses like me. But we are the storytellers, and we see the human impact of policies every day at the bedside. So we have to take those moments and take those stories and share them with the world in the best way possible and as it is appropriate to do so. A personal moment during this for me was just remembering patients whose lives were affected by systemic healthcare barriers and how their stories deserve to be told. And we as nurses and they as patients have the autonomy to do so. But sometimes we don't feel empowered to do so. And that makes all the difference. Up next, we had a conversation about fixing the U.S. healthcare system with guest speaker Vicente Guillermo. He talked about that systemic issues in the healthcare system, including access, quality, cost, and health disparities. He talked about how these issues disproportionately affected Hispanic Latinx communities and brought studies that showed how these disparities impact our communities, but how the disparities that impact the Hispanic Latinx communities aren't all that different from what is impacting all of us as Americans in the United States. Some of the key takeaways were that many of these disparities happen due to multimorbidity or chronic disease, and also there are life expectancy gaps. For me, while he was talking, I just kept thinking about working long shifts in the outpatient oncology unit and seeing patients struggle with access to care for chemo, insurance denials, and also the social determinants of health. Really, it was a moment of realization that this isn't just a broken system. It's a system that's working exactly as it was designed, and that's why we need to redesign it. Up next, we had an incredible speaker, Patricia Neese, with the Obesity Action Coalition, that spoke on addressing obesity and healthcare disparities. She talked about the intersectionality of obesity, race, and health outcomes, and really why this matters for Hispanic Latinx nurses to know and healthcare workers to know. There was a story that she mentioned of a healthcare worker that was speaking with a Hispanic Latinx patient and letting them know that with their markers, they were qualifying as obese, and how obesity is really a health condition and a chronic health condition at that. But their family didn't realize that that person was qualifying as obese. And in fact, they felt like they still needed to gain a little bit more weight. Now, I know that sounds like a funny story to tell, but it shows us how culture also impacts the way that we view health. And in my own experiences, seeing firsthand how Hispanic Latinx patients are often dismissed, misdiagnosed, or not properly offered treatment, it really was heartbreaking, especially seeing how obesity and weight stigma affect our patients and affect our views of them as healthcare providers. Our fifth speaker was talking about prescription drug legislation. We had guest speakers Cynthia Hicks and Sharon Lamberton, who spoke on the role of pharmacy benefit managers and their impact on prescription costs. They gave us a really incredible breakdown about how our drugs come to the market, how difficult of a process it is to actually develop new medications, and once we get them to the market, what that means in terms of prices, who gets to dictate those prices, and who is lobbying for certain medications over others. They gave us some legislative updates on the federal and state levels and talked about what nurses can do to advocate for affordable medications for all of us. They said, let's talk about the real cost of medications, not what's on the label, but what it takes for the patient to actually get what they need. And it really just reminds me that patients sometimes have to decide between buying for groceries or paying for their insulin. And that's not just the symptom of a bad system, that's simply a crisis. The speakers that we had throughout the day were simply just incredible. It was moments like these where you heard their personal stories and also heard about the work that they do on the day to day. It was honestly just so empowering and incredible. Speaking of empowering and incredible, we also had a speaker on rare diseases and health equity. We had guest speakers, Caitlin Schneider and Gerardo Crespo from Amgen, and Jeanette Contreras, founder of the Latina Health Collab. They spoke on the challenges in accessing treatments for rare diseases and the impact of prior authorization delays. Because I don't know about y'all, but I have experienced patients who have to trial certain medications before they can get to the one that will be their right fit. But if they don't trial those other medications first, then we can't put them on the drug that they need. So we need to have policy solutions that improve our health equity. We had emotional moments from the panel and hearing stories about families navigating the impossible healthcare roadblocks. And I really just walked away from this panel with one big thought. Our healthcare system isn't built for the most vulnerable. And that's exactly why we need to advocate. And we see this happen on the day to day as nurses. Up next, we had a talk on climate and social justice in healthcare with guest speaker Dr. Roxana Chicas, who's a nurse scientist. Her work focuses on the impact of climate change on farm workers' health and how chronic dehydration and unsafe working conditions contribute to worse health outcomes for folks that are working every single day to make sure that you and I have food to eat at our tables. Her policy recommendations are about protecting our vulnerable workers on a local level and through our national scale. She gave us a shocking statistic that half of our farm workers start their workday already dehydrated. And by the end of the day, 81% of them are severely dehydrated, which is contributing to acute kidney injury every day for this population. Hearing her talk just made me think about coming from an immigrant background myself and knowing how hard our people work in conditions that are just often ignored by policymakers because it is not in the interest of big corporations. But her work is solution driven. She spoke on things that they have actively studied to do to support our farm workers and make the days a little bit easier for them in the hot sun, and about how grassroots coalitions have been able to work together to make working conditions better in partnering with some of our big corporations. Later on in the day, we had guest speaker Claudia Romo Edelman, founder of We Are All Human Foundation and Hispanic Star. She talked about the power of the Latino voice and started her talk saying, "Hi, hello, hola." Did you know that by 2060, a third of the US population is going to potentially identify as Hispanic Latinx? That means that we are going to have to start greeting each other with hi, hello, hola. So during her talk, she brought up the economic and the social power of the Hispanic Latinx community and Latinos in healthcare. She talked about why Latina nurses have to step up as leaders in healthcare policy to be able to protect our populations. And it's not to say that other healthcare workers can't take care of our populations, but there are some cultural nuances. And because Hispanic Latinx healthcare workers do not currently represent the population in numbers, because there are more percentage of Hispanic patients than there are representation in the nursing workforce, we have to be able to at least match that. And in the meantime, use our voice for advocacy. I had a personal realization that we're the largest growing population in the United States. And we also need to be the largest growing workforce. Hispanic Latinx people and immigrants, in many ways, are the backbone of society. Yet, we're still underrepresented in healthcare, leadership, and policy. That's why, for me, as a master prepared Latina nurse who is an immigrant, it is so important for me to have a platform and be able to speak on these things and bring little nuggets of information to you too. So, the conclusion of that was that what happens when we start taking up space in boardrooms, policy making, and even Congress, things change. And I loved hearing her speak. She was so incredibly animated, and it was really so empowering to see someone of her stature making the impact that she was, coming back to us as nurses, not just Hispanic Latinx nurses, but as nurses in general, saying that we have the power to make that change and we need to use our voice to do so. We rounded out our day with having a guest speaker, Ariel Gonzalez, speaking on legislative advocacy and preparation for our Hill Day. He told us about what advocacy looks like in action and explained the difference between advocacy and lobbying and all of these other terms that I personally didn't realize there was a difference for. They also explained that our call to action for Washington was really to focus on a few key things that are nonpartisan. Part of what I learned while we were talking with him in this space is that we have to be able to use the language of our policymakers to make a difference and also position these potential changes that we want to see in a way that hits home for them. So the biggest things that we focused in on as part of the National Association of Hispanic Nurses going to Capitol Hill to advocate on was the Title VIII nursing workforce development programs and how those things are vital for supporting our existing and future nursing workforce and professionals. We were also focusing on advocating for the National Institute of Nursing's research, which funds research to establish the scientific foundation for quality patient care. We focused on access to equitable healthcare and how essential it is for promoting and maintaining health prevention, managing diseases, reducing unnecessary disability and premature deaths, and ultimately achieving health equity for all Americans. Healthcare is not a privilege, it is a right. Every day we are dealing with more complex patients and more complex health issues. So everybody deserves to have access to the care that they need. We also focused on healthcare education and the workforce and how the U.S. falls short on meeting the demand for nurses, and nurses represent the largest segment of the healthcare workforce. 6.9% of registered nurses specifically identify as Hispanic Latinx. And we need to increase that number to match the population that we serve. And it's essential to foster interest in the nursing profession among new nurses to help fill that gap, which really requires having affordable, accessible programs for nursing students and having qualified educators to train the next generation of our nursing professionals. We also spoke on the impact of climate change and how climate change can negatively impact physical, mental, spiritual, and community health and well being. The speakers that we had throughout the first day really helped gave us a lot of context to be able to advocate for these things as part of our call to Washington. And again, I just want to shout out the National Association of Hispanic Nurses and the Policy and Advocacy Committee for putting together such great resources for us to be able to learn more about these health issues and be able to speak on them the next day when we went to Capitol Hill and met with staffers. So, as part of day 2, we also learned about diversity, equity, and inclusion and belonging in the nursing workforce. We had guest speakers Ruby Alba and Lois Lopez, who are members of the National Association of Hispanic Nurses, and they spoke on anti diversity, equity, and inclusion legislation and that landscape and the impact on nurses, and really about why belonging matters so much in healthcare spaces. They spoke on how nurses have the ability to impact these spaces and rooms, but we have to be there to do so. Belonging is the difference between staying in nursing and being burnt out, between speaking up for a patient and staying silent. So, as nurses, it's our duty to do so. Later on that second day, we went over to Capitol Hill to have our experience meeting with representatives. I personally met with the representatives of the state of Georgia and their staffers because that's where I live. I met with the staffers for Senator Warnock, Senator Ossoff, and Representative Lucy McBath, which was honestly such an incredible experience. And again, being an immigrant, being a nurse, I honestly felt out of place because you always hear about Capitol Hill and politicians doing the work that they do, but I never envisioned myself as a nurse being empowered in such a way to be able to go in those offices, speak on those call to action items, and really make something happen out of it. As I walked into the Russell Senate office building, truly my heart was pounding. I was about to meet with the people who advocate for and shape the very policies that impact our patients and our professions. And the weight of that, the responsibility of that, was not lost on me at all. I truly felt so honored, and with the preparation that we had with the day before, I felt like I was ready to make a difference and just share my personal story. Meeting with Senator Warnock's team, I really realized just how much our voices matter. I was scared, I'm not gonna lie. I was a little nervous because I didn't know what that experience was going to be like. But after I finished speaking with the staffer, I realized I didn't have to be scared because I know what I'm talking about. I am a subject matter expert on healthcare and my personal experience and the patient's experience of the people that I take care of every day. Meeting with Representative Lucy McBath's team, I learned about how nurses can really cut through the noise of politics. With so much information coming out on the day to day, the staffer imparted me some very wise words that everybody, no matter who you are, has a personal connection to nurses. We are able to get information, understand the impact of it, and disseminate it in a way that is impactful because everybody knows a nurse or has been impacted by a nurse, whether it's through their own experience, family experience, or friends. So, as nurses, we have the ability to cut through the noise and get facts to the people and put faces to things that are affecting them. When I met with Senator Ossoff's team, that's truly the moment that I realized that we have to collect our stories to make change and have a voice. She let me know that every call that goes to their team is documented. Every issue that is talked about is documented. And we have to keep calling. We have to keep participating in our democracy to be able to make a difference. Like I said, as an immigrant, I never imagined that I would be there. But there I was, not just advocating for my patients, but for my community, for my colleagues, and for future nurses that will walk this path after me. And I realized that that's not much different than what I strive to do every single day. And I think that's what has lit a spark for me to continue to advocate, continue to participate in these different types of programs, because there are many. The National Association of Hispanic Nurses hosts this event every year moving forward, and they continue to make it better and bigger than the last. And for this experience, I am so incredibly grateful. So I urge you to go and find an organization that you can partner with that has experiences like this. Whether it's an organization like the National Association of Hispanic Nurses or one that hits a little closer to home for you. My call to action is truly that nurses have power as advocates, not just in the work that we do every single day for our patients in their immediate healthcare need, but also for policy and for change, especially with the ever changing nature of our healthcare climate. This was important for me, just as a personal transformation and finding a newfound sense of purpose with my platforms and with the work that I want to do as a nurse. So I encourage you all to get involved in policy and advocate locally. You don't have to go all the way to Washington, D.C. to make a change, although I'm very grateful and blessed that I got the opportunity to do so. But now it really is our time to contact our representatives about the issues that matter most to us as individuals, as nurses, as advocates for our profession, and as advocates for our patients. We need to contact our representatives to support legislation that protects nurses and patients. And please be sure to follow for more for updates on nursing, policy, and nursing professional development for me, Enfermera Mami. Really, at the end of the day of the experience, I sat in my hotel room after that final meeting, and the weight of all of the moment was just sinking in. I came to Washington, D.C. to learn about policy, and I left knowing that I have a responsibility to advocate for my patients, for my fellow nurses, and for the communities that raised me. So I wanted to be able to have the opportunity to share this with you all as well. So that way you can hopefully feel empowered in your voice. Feel empowered knowing that you as a nurse are a subject matter expert and you see the ways that healthcare policy change our patients' care every single day and affect their livelihood. And also affects the work that we do every day. Again, I really just had such immense gratitude for this conference and for having the opportunity to attend this summit. I think what it boils down to is something that I heard from one of the staffers, that democracy is participatory and our voices as nurses matter. So we have to get out there and fight for our people. With that being said, thank you all for listening. I invite you to follow me on social media at Enfermera Mami RN. Also, for the National Association of Hispanic Nurses at NAHN underscore nursing, non-nursing, and also, of course, Nurse.org for more insights and future advocacy opportunities. My final message with this episode is that nursing isn't just a profession, it's truly a movement, and this is only the beginning. Thank you all so much for listening. And if you found this episode helpful, please rate and review the podcast. It will personally help me grow as a nurse podcaster and will help Nurse.org reach more listeners. So be sure to share this with a friend that could use this information and this encouragement. Thank you all so much.